Mr. O'Brien. I'm Juliana Caldecott, I'm a nurse practitioner student. I'll be doing your assessment today. What would you like me to call you?
Patrick.
Okay, hi Patrick, and how are you doing today?
I'm good. How are you?
Good, thanks. So today we'll just be examining your head, ears, eyes, nose, throat, then we'll move on and do an assessment of your heart and your lungs. Does that sound okay?
Yeah, that sounds good.
All right. Will you tell me your name and your birthday?
Patrick O'Brien, April 2nd, 1999.
Thank you. All right, so I'm just going to first just be taking a look, just making sure that your head is symmetrical, normal cephalic. Is it okay if I take a feeling?
Yep.
Just feeling around for any lumps or bumps. All right. No masses are felt. I'm just going to feel your temporal arteries here. Okay, 2+, they're expected. There's no thrills. I'm just going to take a listen to those. Okay, and there's no breeze audible there. Next, I'm just going to take a look at your eyes. So first, I'm just looking to see, look straight at me, your eyes are symmetrical, your sclera are white. Would you be able to pull your eyes down with that for me? Okay, conjunctiva are pink and moist, there's no discharge, and can you pull up? And same there. All right, thank you. I'm just going to take a look, I'm just taking a look at your pupils and how they react to my light, so you're just going to look straight at me. Okay, your pupils are equal, round, reactive to light. That's great. Alright, I'm just going to do a vision test here, so I'm going to stand 6 feet away, and can you read the smallest line for me? You're going to first cover your right eye with your hand.
First cover my
Yep.
right eye with my left hand.
With either hand.
LTFPH.
Perfect, thank you. Okay, now you can take that hand down, and you'll cover the other eye, and read that, the slowest line you can see.
LTFPH.
Perfect. Okay, 20/20 vision bilaterally. And now I'm going to take a look at your eyes with my brighter light. So I'm going to look in your right eye with my right eye here. So you're just going to look straight at me, please. Okay, so that's positive red light reflex. The disc margin is sharp. There's no hemorrhage. And the retinas appear normal. I'm going to check this other side. We'll look with my left eye. Okay. Okay, same as the other side. The red light reflex is intact. The retinas are normal. The disc margin is sharp, and there's no evidence of hemorrhage. That's good. Alrighty, let me just grab. I'm going to switch this to take a look at your ears. Okay, switch that. Alright, first before I move on, I'm just going to test a little bit more of your vision. So you're just going to follow my finger with your eyes. Okay. Your extraocular movements are intact bilaterally, and the convergence is normal. Before I put this earpiece on, I'll take a quick look at your nose, and then I'll move on to your ears. Just looking at your nose here. All right. And the septum is midline. I'm just going to put a light, I'm not sticking anything in, just looking up. You look up for me. Alright, the nasal mucosa is pink and moist. There's no discharge. I'm just going to feel around. Just let me know if you feel any tenderness. Feeling your frontal sinuses, any tenderness?
No.
And the maxillary sinuses, any tenderness?
No.
Okay. Alright, put the earpiece on. So I'm taking a look at your ears first. they're equal in shape and size bilaterally. The auditory canals are pink. I don't see any discharge. And I'm going to take a look in your ears. Just let me know if you feel any discomfort here. Alright, you look head up straight for me. Okay, the tympanic membrane is pearly gray. The conolite reflex is at 5 over here on the right ear. No discharge noted. I want to do that and pulling the pin up and back. Same thing over here. Don't feel any discomfort. Okay, tympanic membrane is pearly gray. Conolite is at 7. Looks good. Now I'm just going to do a couple of hearing tests. So I'm just going to do some tests here. You're going to let me know first, when I put this on your head, if you hear the sound louder in either of your ears or if it's the same in both, okay?
Okay.
Just do it one more time.
One more time, sure. The same.
The same in both ears?
Yeah.
Okay. So that's the Weber test, and that's normal. I'm going to test the ring test. So I'm going to tap this again, and you're going to hear 2 sounds, and you're going to tell me which way is louder. Let me tap it. It's not really coming out. Hold on. Okay. Like that, or like that?
First one.
Okay. I'm going to do it again while I'm not talking.
First one.
Okay. We'll do the same thing on the side.
First one.
Okay, one more time.
Definitely the first one.
Okay. Put that away. And then I'm going to have you turn your back to me. And I'm just going to whisper a few things while you repeat back what you hear from me.
1, 2, 3.
1, 2, 3.
7, 8, 9.
Okay, and will you tell me when you hear any sound and which side you hear it on? Right?
Yep. Left.
Okay, perfect. Thank you. Just put these ones away. Get some light on here. Alright, I'm going to take a look in your mouth. Some keys. Alright, can I have you open up your mouth first? I'm just looking, you can keep your tongue in front. I'm just taking a look at your teeth. Here, top, down here. Okay. Your dentition looks good, adequate dental hygiene. I'll take a look again. Put on some balloons. Alright, I'm going to use this tongue repressor here and I'm going to stick this in. Will you say ah for me? Alright, hold that down. Alright, the uvula is midline, the oral mucosa is pink and moist, there's no lesions or sores. The tonsils are 1+, no inflammation. The posterior oral pharynx is pink. And just looking around, will you lift your tongue up for me? Okay, no abnormal, and stick it to the right and the left. No abnormal growths or masses noted. Thank you. I'm just going to feel around a few things. So I'm just going to feel your lymph nodes. You're just going to feel me touching. I'm just feeling for any tenderness or lymph nodes there. I'm going to feel the submental and the submandibular, no palpable nodes, the preocular, postocular, the post-occipital, and we turn to the side for me. Post-occipital, just feeling back down where I was feeling before. Alright, no palpable nodes. And down the posterior chain, no palpable nodes, and I'm going to feel your supraclavicular, so if you can try to stick those out for me so I can feel. Okay, no palpable nodes. And then typically you have a shirt off. I'm going to feel for your axillary. Let me know if I'm bugging you. Okay, no palpable nodes, and other side. Okay. And I'm going to feel your trachea, so I'll feel the suprasternal notch. And find the trachea here. And then will you swallow for me? Okay, and will you take a deep breath in and out? Okay. So the trachea is midline, there's no deviations with breathing. I'm gonna feel your thyroid. So I'll find this bone here. And the thyroid, will you swallow for me? Okay, the thyroid is smooth, there's no nodules or enlargements felt. Let me just put this back over here. There. Alright, and I'm just gonna feel your jaw. And will you open and close your mouth? Let me know if there's any pain or I'm feeling for any clicking. No pain or clicking. Looking for TMJ there. Okay. Perfect. Alright. Then we'll take a quick break and we'll move on to examine your heart and your lungs, okay? Okay, so both this respiratory and cardiac exams would be done without the patient's shirt on, keeping on forward. The next part of our exam will be examining your lungs and your respiratory system. Are you having any trouble breathing right now?
No.
No? And do you smoke any tobacco products or use any tobacco?
No.
No. Okay, so no signs of tobacco use, and patients in no acute distress, remains alert and oriented. First, I'm going to do your assessment on your posterior side, then we'll do the anterior. So if you can turn and face that way for me, and scoot forward, please. Okay, I'm just feeling around. Let me know if you feel any tenderness. Alright, I'm going to put my hands on your back. When I press down and hold my fingers like this, you're going to take a deep breath, okay? Deep breath. Okay, deep breath. And one more. Okay, so your respirations are symmetric, chest is symmetric. And I'm going to do the exam. So when I put my hands down on your back, you're going to say 99. This is the tactile tremendous test.
99, 99, 99, 99, 99, 99, 99, 99. Okay, there's expected tremendous, normal finding. Now I'm just going to take a listen to your lungs. So you sit up straight for me. And when I press my stethoscope down on your back, you're going to take a deep breath in through your nose, out through your mouth. Okay, breath sounds are present throughout. Bilateral lung sounds are clear posteriorly. Next, when I place my stethoscope down on your back, you're going to say 99. This is the bronchophony test. 99, 99, 99, 99, 99, 99.
Okay, bronchophony test is negative. All sounds were muffled. Next is the egophony test. So when I place my stethoscope down, you're going to say E.
E, 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 E.
Okay, egophony test is negative. All sounds sounded like an E, not an A. The last one is the whispered paraloque test. So when I place my stethoscope down, you're going to whisper 1, 2, 3. Okay, and again, all sounds are muffled. So the whisper test is negative and normal. Next, you're just going to feel some tapping on your back. I'm going to percuss. Okay, all areas are resonant. There's no areas of dullness. So next we're going to do the same exam on your front side. So I'm going to have you turn and we're going to do kind of a different position. I'm going to have you lay back. sit forward a little so you can lay back. Okay. First, I'm just gonna look. Your chest appears symmetric. Just feeling around. All right. I'm gonna put my hands down like I did. When I press my hands down, you're gonna take a deep breath. Okay, chest is symmetrical with respirations. Next, we're gonna do that chest where when I put my hands down, you're gonna say 99.
99, 99, 99, 99.
Okay, tactile femidus test is normal. There's normal expected femidus. Next, I'm just gonna do the listening. So when I place my stethoscope down, just take deep breaths in through your nose, up through your mouth. Okay, again, the breath sounds are present throughout. The lung fields are clear anteriorly. There's no adventitious sounds. So next I'm going to do where I place my stethoscope down and listen, and you're going to say 99, the bronchophony test.
$99, $99, $99, $99, $99, $99.
Okay, bronchophony is negative. All the sounds are muffled. Next is the egophony test, or the one where you're going to say E when I place my stethoscope down. That's good.
Thank you. E, 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 E.
Okay. Egophony test is negative. Nothing sounds like an A. All sounds like an E. Lastly, we're going to do that whisper test where you whisper 1, 2, 3 when you feel the stethoscope.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay. Whisper test is negative. And last, I'm just going to percuss like I did before. Okay, all areas are resonant. There's no areas of dullness. Next, we'll move on to now I'm going to assess your heart. So first, I'm just taking a look. The shirt would be off again for this. So your chest is symmetric. Are you having any chest pain?
No.
Or pressure? No. Okay. Feeling around any tenderness?
Nope.
Okay. I'm going to take a look at your hands and your feet. Okay. No signs of cyanosis. Good perfusion. Feeling for capillary refill on all the fingers. Okay. Capillary refill less than 2 seconds. I'm checking both legs for any edema and your ankles. Okay. No edema noted. I'm going to check the capillary refill of your toes. Okay, and I'm going to palpate your carotid artery. Okay, the carotids are bilateral 2+, expected. There's no thrills. I'm just going to take a listen to those. Okay, and the other side. Okay, and there's no worries audible in there. All right, now I'm just gonna feel down, feel your arteries. So we did the carotids. I'm gonna do the brachial. And the shirt would be off for this. Will you extend your arms out like that for me? ulnar. Okay, and femoral, can you lay back for me? Okay, and popliteal. And tibial. And the dorsalis pedis on your feet. Okay, so all those arteries I just checked, they're equal and strong bilaterally, 2+. There's no frills. Now I'm just going to take a listen to the femoral right here. This would be done without clothes. Okay, no bruits are audible there. I'll take this one off. Alrighty. I'll leave this over here. Use this. Okay, I'm gonna have you lay back at a 45-degree angle, so you can scoot forward a little bit. And I'm gonna have you lay back, and you're gonna look over to the left for me. Okay. Find the sternal notch. This ruler here. Okay, there's no jugular vein distension. The JVP is less than 4 centimeters. It's found to be at 3. You can sit back up for me. Take a listen. Just checking to make sure there's no pulsations here. None visible. I'm just taking a listen. No bruits audible there. And next I'm going to take a listen to your heart. So first we'll do it with you sitting up, and then I'll have you do it with you laying down, okay?
Yep.
So I'm going to listen to the aortic valve. And the pulmonic. And Erb's point. And the tricuspid. And the mitral, the apex. Okay, so listening there, S1 and S2 are present. There's no abnormal heart sounds, no murmurs, gallops, or rubs. I'm going to listen with the bell and stethoscope to make sure. The heart rate is 60, regular. I'm just going to listen with the other side. You can sit up still for this. Okay, confirm there's no murmurs, gallops, or rubs. I'm just going to feel for the PMI, the point of maximal impulse. Okay, it's brisk and tapping. The diameter is less than 3 centimeters. And then I'm just going to have you lay back and kind of lean onto your left a little bit. I'm going to feel that under here. Okay. I'll have you scoot forward so you can lay back a little bit more for me. Okay. I'll let you lay on your side over there. Can you lean this way a little bit for me? I'm just making sure that the PMI is in the right spot. Okay. At the 5th intercostal and the midclavicular line. Now you can lay back flat. I'm just going to listen to your heart. Those same spots. again, S1 and S2 are present. There's no extra heart sounds, no murmurs, gallops, or rubs. Let me just put this away over here. Okay, that concludes our exam today. Do you have any questions or anything else I can do for you?
No, I don't think so.
All right, thank you so much. It was nice to see you.
Thanks.
Bye.